Hello everyone, today I am going to teach about CPR demo class, Cardiopulmonary Resuscitation. I am Sneha from the Department of Physician Assistant, SNS College of Allied Health Science. I am going to teach how to do CPR. CPR stands for Cardiopulmonary Resuscitation. The purpose of CPR is to restore the blood circulation and oxygenation in the body. CPR is a life-saving technique when someone's heart stops beating or they stop breathing. First, we have to identify the signs of cardiac arrest. These are all the signs of cardiac arrest. The first one is the person is unresponsive, person is not breathing or only gasping, or no pulse. Brain damage can start within 4 to 6 minutes without oxygen. So you have to start the CPR immediately after cardiac arrest. Today we are going to learn a life-saving skill that could make you a hero in an emergency. Imagine you are at a park and someone collapses. Would you know what to do? CPR is a simple yet powerful technique to restore breathing and circulation in someone whose heart stops. By the end of this class, you will understand the basic of CPR, see a quick demo, and even get a chance to try it yourself. Ready? Let's dive in. Okay, let me explain what are the steps in CPR. In step 1, we have to ensure the safety of the collapsed person. In step 2, we have to check the responsiveness of the patient. For checking the responsiveness, we have to tap shoulder and shout the person name or are you alert? In step 3, we have to call for help. Call 108 or send someone to get an AED. AED means automated external defibrillator. If no one is there, you have to call 108 immediately and put it on speakerphone. After calling for help, you have to check the pulse of the patient. In CPR, we have to check the carotid pulse of the patient and also check the airway obstruction. If any obstruction present in the airway, next we have to check the breathing. If patient is breathing or not breathing. We have to check the chest movements like inspiration, expiration and all. For checking the breathing, we have to look the chest movements and listen the breathing sound and feel the breath. We have to do this all in a quick setup. At the same time, we have to look the chest movement, listen the breathing sound and feel the breathing. If breathing present, we don't have to worry. If patient is not breathing, we have to start the CPR immediately. Before starting this CPR, we have to check the safety for the patient as well as us, or we have to shift the collapsed person in a safe environment. Then if the person arrives with the automated external defibrillator, we have to use the AED as soon as possible. It is a device that can shock the heart back to a normal rhythm. If AED is not available, we have to do CPR continuously until the help arrives. Okay, let me explain how to do CPR. Before starting the CPR, lie down the patient flat. Before starting the compression, you have to place your heel in between the nipples, 2 fingers above the zippy sternum. Now let's see CPR in action on this mannequin. I will go through the steps. Check the scene, call 108, start compressions, open the airway and give breaths. Watch closely. For doing chest compression, elbow should be straight. You have to place the heel between the nipples. 2 hands should be in interlocking method. Then start doing compressions. Compressions ratio should be 30 chest compressions and 2 artificial respiration. You have to start the CPR as soon as possible, immediately after the cardiac arrest. Starting the chest compression like 1, 2, 3, 4, 5, like that you have to compress 30 times in the chest.